Okay, folks, good evening, everyone. My name is Bobby Clark. I'm the Director of Communications with Nisga'a government, and I have the honor of being your moderator this evening. We are joined by an excellent group of expert panelists that will provide us information and updates on recent events in relation to COVID-19 in the Nass Valley. Before we get started, I would like to call on the kindness of our a member of the executive that has joined us this evening, Mrs. Corinne McKay, who is the Secretary Treasurer of the Nisga'a Nation, if she will open us in a word of prayer to get us started in a good way. Madam.
Thank you, Bobby. I just want to thank those that have taken the time to coordinate this event and appreciate the efforts that you're taking to keep our people informed and to mitigate any risks. So with that, I'd like to ask you all to bow your heads and your hearts. Dear Lord, we come to you today with gratefulness for all that you provide to us. We pray that you would go before all of those that are feeling unsure and uncertain and afraid during this uncertain time. We pray that you would go before them, that you would guide and protect each and every one of us, that you would be with those that are still grieving, that you would comfort them. And we pray that you would help us to understand, help us to learn ways that we can live in this new world that we're all faced with. We pray that you would be with those that are working behind the scenes to keep us safe. And we thank you that we can call upon them to lead us and guide us. We pray that you would go before all of our people. This we ask in the name of Jesus. Amen.
Thank you very much, Madam Secretary Treasurer. So once again, welcome to everyone, and thank you for coming on relatively short notice for this very important information session. This is the agenda that we published earlier this afternoon. As you will see, we are joined by guest panelists from Nisga'a Valley Health, Nisga'a government, and Northern Health Authority. So we have from Nisga'a Valley Health, we have Brandi Trudell-Davis, who is the Chief Executive Officer of Nisga'a Valley Health Authority. And we have Anthony Moore, who is Nisga'a government's Emergency Response Services Manager, who has been at the helm of the Nisga'a Nation's response in collaboration with the villages and the various entities in the nation. And we also have with us Dr. Jong Kim, who is the Interim Chief Medical Officer for Northern Health Authority. And Dr. Jeremy Penner, who is the Medical Director for Nisga'a Valley Health Authority. And we also have Sadeed Habib, who is Nisga'a Valley Health Authority's public health nurse. Each of our panelists will be presenting on various aspects of our content overview tonight, starting with Brandi Trudell-Davis, who will provide us an overview and update of the potential COVID update exposure in the Nass and the response that the nation has taken to that. And we will welcome Sadeed, who will provide us an overview and update on COVID-19's test statistics to date. And then we'll welcome Dr. Penner and Dr. Kim, who will give us an overview of who is at risk. And they will continue their discussion on testing, the who, when, and where of who should be tested. And then Brandi will take us into a discussion about contact tracing and what that involves. And Sadeed will provide us an overview of self-monitoring versus active daily monitoring. And then we'll welcome Anthony Moore, who will provide us an update and overview of the various initiatives that the Emergency Preparedness Committee has been undertaking since the beginning of COVID and more recently within the last week. And then again, Brandi will provide us an overview of next steps on the part of Nisga'a Valley Health. That should bring us to about 40 minutes of discussions, at which point we will entertain a question and answer period. We have, as you'll see at the bottom of your Zoom screen, there is a Q&A button, and we will be welcoming questions through there. So I will ask the questions to the panelists on your behalf. And bearing in mind that there are now 111 participants, we don't know how many questions we'll get, but certainly entertain your questions through the Q&A button at the bottom of your screen. And just as a matter of housekeeping, we would ask that all panelists and participants posing questions to please respect the privacy of all individuals and all recent events that have taken place recently. We must, with the utmost respect those individuals and their privacy. So thank you in advance for your cooperation in that regard. And again, as I mentioned, if we don't have enough time to get to all of the questions, we are documenting them. And as we have done in previous webinars, we have developed a Q&A document that we've posted onto our website following the webinars. So if your question isn't answered, just take comfort in knowing that it will be documented and it will be answered by one of the panelists that it's directed to. So without further ado, welcome once again if you're just joining us. We are just getting into our panel presentations now. So I would now like to welcome forward Ms. Brandi Trudell-Davis, the Chief Executive Officer of Nisga'a Valley Health Authority. Welcome, Brandi.
Thank you. I would like to take this opportunity to thank everybody for coming on with such short notice. We do acknowledge that it's a really difficult time and there's many things happening in the Valley. So thank you everybody who has logged on today. So I just want to give an overview of the latest COVID update in the Nass. First and foremost, to date, there have been no positive confirmed cases of COVID in the Nass. And it was kind of an afterthought after the information had gone out yesterday, or sorry, on Saturday. That was probably something that we needed to really focus on to assure the community that there has been no positive confirmed cases of COVID in the Nass Valley. So just to kind of go through the events, on Saturday, August 29th, 5 members who live in Vancouver Coastal Region who attended the services for Dr. Joe Gosnell self-reported positive COVID-19 tests upon arrival back home. These members were either close contacts or were actually at the services for the late Dr. Joseph Gosnell. So, and it's not clear what services, if it was the funeral, the memorial, or the feast. And that's not really, we don't need to know exactly, but we do know that they were in the community in a potentially infectious stage of COVID. Upon notification on Saturday, working very closely, the Emergency Operations Committee and NVHA implemented the collaborative pandemic plan. So Nisga'a Valley Health Authority took our part, and Anthony and his team took kind of the nation part of the pandemic plan. And just to assure the nation, these pandemic plans have been developed, very well developed over the last 6 months. So it was very easy to implement the processes. So Nisga'a Valley Health Authority initiated immediate testing of the members within the traditional lands who were identified as most at risk of transmission. So this included the family members of Dr. Joe Gosnell, the undertakers, the presenters, and the Nisga'a, I'm sorry, I can't say it, the Nisga'a band members. And so this happened Saturday and Sunday. During that time, we did about 114 tests, COVID tests. We haven't received any of the tests back yet, and Sadeed will present more on the testing. Due to the challenges with the immediate implementation of the reduced risk protocols, the Nisga'a Nation implemented mandatory self-isolation of Dr. Joseph Gosnell's services and travel restrictions. So immediately we did say on Saturday that we are hoping, and we're very hopeful, that all the attendees of the services would self-isolate for the 14 days until we had more information about what was happening. Currently, all 5 self-identified cases are being followed by Vancouver Coastal Health Authority and their pandemic team. Nisga'a Valley Health has received no official communication from Vancouver Coastal, Northern Health Authority, First Nation Health Authority, or other provincial health authorities. So again, we want to assure the nation that the measures that are in place now are of a prevention focus. They are not focused on actual positive confirmed cases. The implementation of the pandemic plan is really focused on preventing any risk to our nation. Sorry, I'm just going to move down. So now I will pass it over to Sadeed, who is the public health nurse and also our public health lead for any COVID response, to speak on our test statistics.
Thank you, Brandi, for that brief overview. And with that, Sadeed, are you prepared to begin your portion?
There we go. So we started testing on Saturday, and to date we have tested close to 379 individuals. Of these, over the weekend, 114 were tested, and there are 194 pending. So meaning that 194 results are still in the lab being processed. And I will be contacting, and the nurses at the different clinics will be contacting the individuals with their test results.
Great, thank you. So just a quick question in that regard. I know that Nisga'a Valley Health had begun testing since March. So that 394 number you mentioned, is that all inclusive of since March?
So it's 374 since March, 379. Over the weekend, 114. And the testing is continuing on daily. At the in IANJ, it's between 2 and 4 p.m. Yeah.
Okay, great, thanks. So for any of our attendees that are interested in getting tested, if you're showing symptoms of COVID-19, you're encouraged to get tested. So with that, we'll get into our discussion with Dr. Kim and Dr. Penner on the risks, or who is at risk with COVID-19. So I'll allow the two of you to start that discussion.
If it's okay with Dr. Penner, it's Dr. Kim from the Chief Medical Officer with Northern Health. I can just speak generally to COVID-19, how it is spread, and who might be at the risk of infection, and check with Dr. Penner about any additional comments or any corrections on that. So COVID-19 is a viral illness. Like, its a main mode of spread is through the droplet. Droplet is a small particle, but it's big enough that it doesn't sustain in the air. So it comes out of the body, it goes projected out of body, and it drops on the ground. So with the COVID-19, like we need people who with the COVID-19 with a high viral load, so it's a lot of virus in their body, as well as some way to get the virus out of the body. So people who are showing the sign of symptoms like a fever and also a kind of symptom like a cough or diarrhea, get the virus out, are the most infectious people. And the person who are exposed at the risk of getting infected if they're getting the droplet. So with a droplet, it can get out of the body, but it drop on the air. So we count that the close contact as someone who is within the 2 meters, spend significant amount of time, at least 50 minutes or more. So they have of the infectious person, then you might be at the risk of that droplet that might get into your body and develop kind of infection. So those are kind of how that's the most probable way the COVID-19 kind of spread. So we define the close contact are people who are in the contact with the people who are symptomatic or people who are pre-symptomatic, so just about to have a symptoms, and spend more than 15 minutes in a 2 meters in a distance at that time. So those are the kind of close contact that consider as a highest risk and will be followed by kind of public health. So just to distinguish that some people will be directly contacted by the public health to do some special practice, and some additional people, as people in the community has received, that there will be notification and instruction from for example, that Nisga'a Valley Health Authority to do some special actions, to take special actions. On the other end, just building on that we are living in a new world, so that reality of the new world is that everybody have to assume that we are at the risk of COVID-19. No one is free of COVID-19 risk. So everybody is at some risk of COVID-19. At the same time, the regular practice we do as an individual, as a community, in this new norm is designed to protect us. So by everyone doing well with the regular practice, like a good hand hygiene, stay home if you're sick and get tested, and remaining the physical distancing of the 2 meters, also safe gathering, that hanging out with a smaller group of closer kind of friends, and avoiding crowded place and so on, will protect everybody. I just really wants to kind of underline that. And so some of us might be worried that I'm in friends or in contact with someone at the funerals. For most of us who are not directly by the contact direct with public health, who not at the directly mentioned in the instruction from the Nisga'a Valley kind of notifications, for most of us, everybody, by doing the regular practice well, that we will be able to protect everybody in the community. And Nisga'a Valley has taken rigorous measures as a community to control the risk of the COVID-19 kind of transmission. So it will kind of continuing on that kind of new norm, regular measures in the Nisga'a Valley will protect community members. I will just stop at there, and happy to take any questions around this. Also, just pass on to Dr. Pennell to add any corrections or any additions.
Sure. Once again, we'll go through the list of panelists, and then we'll entertain a question and answer period at the conclusion of each of the presentations. We do note that there are questions rolling in already, which is excellent. So with that, we will welcome Dr. Penner.
Thank you, and thank you, Dr. Kim. That was very clear and precise description of who is at risk, and so that's really overall who's at risk, and then specifically related to the recent events. As Dr. Kim mentioned, there were some people who really they didn't have symptoms yet when they were at these events, but they developed symptoms shortly after. So they were not at really a high risk of transmitting COVID during the memorial events, but to be have extra precaution, we triggered the testing, and community notification. And even people at these events, as Dr. Kim said, it would only be people who spent at least 15 minutes within 2 meters of the people who would be most at risk. So it's not everyone who attended, and it's not the family members of people who attended, or the contacts, like the secondary contacts of people who attended at this time. Also, you know, as Dr. Kim mentioned, this is our new normal. So this certainly won't be the last time we have people in the Valley who test positive for COVID, and we have to really assume that any of us could be COVID positive. And so these general measures that Dr. Kim talked about, really we need to be taking them to protect ourselves and also to be protecting our loved ones around us. So wearing masks whenever we're around other people, having proper hand hygiene, keeping to ourselves a bit more, and not going to work or school or gatherings if we have any symptoms of a cough or cold or flu. We need to protect ourselves and protect everyone around us. So I don't have anything to add about who's specifically at risk, other than just saying that the main issue now is anyone who attended the events who's showing symptoms of COVID. And really it's a broad range of symptoms. So anything that makes you think you have a cough, cold, or flu. It can be fever, chills, cough, trouble breathing, runny nose, sore throat, loss of sense of smell or taste, headaches, fatigue, nausea, vomiting, muscle aches, all of those things that people get sort of every year during cough, cold, flu symptoms could potentially be COVID. So those are the ones that are highest priority for getting tested right now. And let me see. And also the one that's most critical for self-isolation, which Sadeed will be talking about afterwards.
Great, thank you, Dr. Penner. And as you probably see the questions rolling in, and which kind of takes us to our next agenda item, which is all about testing and who should get tested, where, and at what stage in the process that they think they may be infected. Should they, is there a period where it may be too early to get tested, or should folks just wait until they show symptoms to get tested? What's the most recommended approach in that regard?
Thanks.
I can provide a quick and ask for Dr. Penner for any kind of additions or corrections like on that. In terms of the timing of the kind of testing, like that current testing does have a kind of struggle when tested too early, and we had a challenge with a false negative that the test might not detect the person who will eventually develop the disease, like from that exposure. And we also have the test is also, it's designed to be very sensitive. It picks up the piece of genetic information of the virus, but it actually doesn't distinguish the live virus and the piece of dead virus. So the test is designed to really pick up any sign of the virus, live or dead, in your body. So with the COVID-19 kind of keep going on, there has been people who exposed COVID-19 months ago, no longer has an active infection, no longer has a live virus in their body, or might have that genetic information virus. Tests can still pick up that. So there is a bit of challenge of the testing. If done not at the right timing or too early, I have a false negative or false positive. So that the priority for testing is for people who are having the symptoms. So by that way, that we can interpret that test result more reliably by correlating that person has a COVID-like symptom and the test is telling us that the person has a COVID, the virus in their body. So then we can correlate the person likely have that, the COVID infection. At the same time, the person who has a symptom, there's a bit of urgency to really make a diagnosis of that person. In case the person gets worse, having the diagnosis or confirmation of COVID-19 can direct what's the best clinical care for that individual. And also for the community, that the person who has a symptom, is important to know that person has COVID-19, so ensuring and the person is isolating. And people need a support for isolating, like where you are isolating at home. Like if you don't have a grocery in your home, it's difficult to isolate at home. So ensuring that the person has confirmation and the public health and community service is aware, so we can provide the support, the person and the family to kind of isolate. So the priority, both for the quality of testing and the reliability of testing, as well as the measures for the individual care and the measure for the public health, is the testing symptomatic people. And now, and happy to take any questions, more questions on the testing, and also pass on to Dr. Penner. Sorry to interrupt, and any additions, any corrections?
Sure, thanks for that, Dr. Kim. Dr. Penner, did you have more to add to that?
The only thing I'll add is that, you know, for this particular situation, we're not sure that the visitors who later tested positive for COVID brought COVID into the valley. It is possible, at least for one of them, that COVID was already in the valley and they picked up the infection while in the valley. So we're also interested in people who had symptoms recently, like around the time of the memorial events or a little bit before, and they may be feeling fine now, but they could have actually had COVID already without realizing it, just thinking that they had a regular cough or flu. And so it's so those people who recently had symptoms and are feeling better, we'd also want to test them. And as Dr. Kim mentioned, the test may still be positive for those people, even though they're no longer feeling sick. It won't affect so much the management of those people, but it will help us identify their contacts then as well, if there is an outbreak in the valley.
Great. Thank you, Dr. Penner and Dr. Kim for that. Brandi, did you have anything additional to add to that?
I did just want to remind community members that receiving a negative COVID laboratory test does not negate the self-isolation period, as it could very well be a negative, and thank goodness it's a negative, but we don't know for sure if that's a negative, that you're not exposed and that you're not contagious. So I just really wanted to remind community members that the testing is great to direct care and to make sure we're identifying those that may need higher level of care, but it does not negate the self-isolation period if you are symptomatic.
Okay, perfect. Great, thank you all. You're clarifying a lot of, I think, a lot of important information for folks. So continuing on with our discussion, Brandi is now going to provide us an overview of contact tracing. Brandi?
Thank you, Bobby. So contact tracing is a process in which public health will identify potential contacts of laboratory confirmed cases of COVID. So for instance, if the test that came back positive in Vancouver Coastal, it's their public health responsibility to be contacting that individual, getting a list of potential contacts, and then they will be reaching out to those potential contacts to do an assessment, and also if they are symptomatic, refer them over to testing. So right now, because the identified cases are within the Vancouver coastal area, that's not Nisga'a Valley Health's responsibility to be contact tracing, because we don't have the information, the proper information. Really, the only information we're going on right now is self-referral. We're not going on any information that we've received from Vancouver Coastal. So it is Vancouver Coastal's responsibility to be connecting with those identified urban members and then getting their contacts, and they will be contacting, potentially contacting people in the Nass. And those people in the Nass will then be referred to our health services for to kind of follow up and figure things out. So Nisga'a Valley Health Authority is responsible to carry out our COVID-19 tests on those community members who have been identified and have received communication directly by Vancouver Coastal or other health authorities. Nisga'a Valley Health Authority is responsible to carry out that contact tracing and communicating with all identified contacts within the Nass and outside of the Nass for those community members that we are identifying and testing as COVID positive. That's it. So I did just want to clarify, it may seem like Nisga'a Valley Health isn't reaching out. The reason we're not reaching out to these individuals is because we don't have the proper information and we don't have the authority yet to be reaching out to them. So Vancouver, if there is potential contacts, I just want community members to know that it would be Vancouver Coastal Health Authority that reaches out to them, and then we would take responsibility after that.
Okay, thank you, Brandi. We'll now move along to the next item on our agenda. This will be led by Sadeed, and this is in relation to self-monitoring versus active daily monitoring. Sadeed.
Hello. So with regards to self-monitoring, again, it's what we ask of the general public to do generally, on a daily basis, as we are in this kind of new world, to look for those flu-like symptoms, as Dr. Penner and Dr. Kim mentioned, from fever to cough, malaise, meaning body ache, runny nose, diarrhea, sore throat, if they're coughing, and more in severe cases or ones that you would definitely, I would recommend seeking help, attention from your clinic nurse, overnight, to use the emergency line if you have shortness of breath and have difficulty breathing or chest pain. But for the fever, cough, body aches and sore throat, I would recommend to call during the day to have the nurse assess, and we will leave it up to the nurse whom you speak with to decide if you will need a COVID swab or not. Now, active monitoring is once you've been identified, to isolate the individuals we have swabbed recently, and in the current case, to look for things like chills, pink eye, cough, diarrhea, fatigue, runny nose, shortness of breath or difficulty breathing, sore throat, and to create a journal, a log of sort at home, just a piece of pen and paper, to monitor for 14 days. If you have a thermometer, to check your temperature daily. As well, we will contact you on a daily basis for the individuals we've swabbed, and to make sure that these symptoms are not getting worse. And hopefully that's also a reminder to, create a log for that call. So you have that information to provide to the staff members who are calling you. And now, one thing to note as well is, with the temperature and the shortness of breath or difficulty breathing and chest pain, the issue is that even though some might experience a mild case of symptoms for COVID, we are watchful for those who will have moderate to severe cases. And with that, the issue is that we don't want that to be delayed. And that's one of the reasons for the daily checkups by the staff who call, because, especially if individuals are alone at home, that these symptoms could get worse very quickly for severe cases, but also these severe cases are not the norm. They're not the most people. And also, it does not really, even though there are, statistically, we could say this age group to this age group has a higher kind of risk. There's also an association with other health challenges like heart disease and diabetes, and those things seem to also have a correlationship with more severity. But the idea is that you could say you are young or you are healthy and that your case would not be as severe. I would caution against that, because until we have it, we won't know. And to not take precautions and put yourself or others at risk, that won't be very wise, simply because anyone can get it and anyone can have a severe case as well.
Okay, great. Thank you for that, Sadeed. Dr. Kim, Dr. Penner, or Brandi, did you have anything further to add in relation to that?
Thank you so much for the great explanation, Sadeed. Just adding kind of both Brandi's comments and Sadeed, that step monitoring it's a regular practice for everybody, like in the new norm. Like we all kind of monitor how we are doing, and if we become symptomatic, we kind of isolate and call kind of 811 to get us kind of assessed, so we can be kind of properly kind of supported. And underlining that is that as important as a contact and like a case and contact tracing is this doing well with the regular practice by the community members is really what controls transmission of COVID-19. Another just quick thing to add, Sadeed, with this kind of a good practice around self-monitoring, that early kind of timely kind of testing and assessments, and that continued support with active daily monitoring. We've been seeing in a BC that in the old age group, as Sadeed mentioned, that hospitalization and severe disease is going down, and that is the kind of the plan with this kind of good work and collaboration that we will kind of support the community
members. Thank you, Dr. Kim. Dr. Penner or Brandi, anything further to add to that?
Yeah, I think just related to some of the points that Sadeed had made, and also based on some of the questions coming in. I know we'll get to questions after, but to reiterate that the self-isolation period is we're saying is 14 days, and that's because of the potential incubation period. So someone who has had a contact with someone with COVID and is at risk for acquiring it will usually show symptoms after about 5 to 7 days, but they can remain without symptoms for up to 2 weeks, even a bit longer in some cases, but pretty much by 2 weeks, most people will have shown symptoms. And if someone is tested before they show symptoms, as Dr. Kim mentioned, it may just be because the virus hasn't been replicating enough in the body. So the test may be negative, but really the person does have COVID. So when we talk about the self-isolation period, it's not related to a negative COVID test. So if someone tests negative, they do still need to self-isolate for that full period.
And if I may add, with regards to our results when they come back negative, like Dr. Penner's saying, to continue with the 14 days, but as well to be mindful with the daily monitoring as usual, because if you could imagine the COVID test being kind of a snapshot, a picture in that moment, and in that moment you may not have had COVID, but you could contract it on your way out, and you could contract it at the store 10 minutes later, or when meeting someone, you know. And so then 14 days later, you've not, or you know, at some point the results come and the results are negative, but now you just might be brewing the COVID symptoms. So therefore, the whole idea behind social isolation and social distancing as a rule, as a general rule, because you know, that COVID test is in that moment that the test happens.
And to add to that, so if someone tests negative and then later they develop symptoms a week or two later, we'd encourage them to come back and get another test. We'd consider it a new test for a new situation, because now they have symptoms and should get a test.
Okay, great. Thank you all for that. I think that clarifies a lot of the incoming questions that are rolling in. So thank you to all of our medical professionals for the very comprehensive and detailed information that you've provided this evening. Once again, we'll roll along with our agenda before we enter a Q&A session. So if you could just please stand by. And we'll now welcome forward Mr. Anthony Moore, who is Nisga'a Government Emergency Response Services Manager. And Anthony has been the lead for the nation, working in collaboration with Nisga'a Valley Health and the RCMP and the 4 Nisga'a village governments and school district to manage the nation's response to COVID-19. They've been working actively since March, and Anthony is going to provide us sort of an overview of all of the activities that have taken place since then, and more particularly the most recent events within the last week. So Anthony, welcome.
Thank you, Bobby, and good evening to everybody. So since we began from phase 1 back in March, coming in through June, our response was basically to try keep our elders, our vulnerable populations within the Nass Valley safe from the spread of COVID-19. That has been our overarching goal throughout this entire pandemic. And as the province started to implement their strategic restart plan, our goal was not to rush in to see how the nation would respond. Our goal was to see how the people were reacting throughout the province to each phase. So when they went to phase 2, we noticed immediately that there was not a lot of compliance. A lot of things didn't go the way that the province had hoped. and we took actions to maintain things like keeping our provincial parks closed, keeping our lakes closed, as well as our tourist sites and our villages. Those actions we felt would help keep the tourists, the recreational users, and general highway users from coming into the valley while the pandemic was going on. There was still a lot of tourists wanting to come through, but we didn't know how many. We didn't know when they were coming through. So from the onset of the pandemic way back in March, we began planning the steps necessary through the Ministry of Transportation and Infrastructure, the Ministry of Forest Lands and Natural Resource Operations, to begin a checkpoint. There's been many different iterations of checkpoints in First Nations communities throughout the province, but us being Treaty First Nations and with the highway and the way our villages are structured, it was very difficult to get a checkpoint up for each community, mostly because of the capacity for each community wasn't high enough to be able to establish a checkpoint in each of the 4 communities. That being said, there was one established early on, and it was shown to be very effective at the end of the Nisga'a Highway in Gingolch, but with the designs of the other villages, Lakaldzap in particular, we're not able to do a similar checkpoint that Gingolch had set up. So my goal from that point was to figure out a way to establish a checkpoint on the highway and get the blessing of the Ministry of Transportation. And that took a lot of planning, a lot of back and forth meetings with members of the office out of Terrace, as well as the managers and regional directors. So we went back and forth basically from April and May until we were able to establish what needed to be in a checkpoint. Early on, people were making suggestions of using security guards, but that was not going to be approved by the Ministry of Transportation, so we had to come up with a different solution. Because of the dynamics of working on a highway, it was clear that we had to go the route of traffic control persons, getting those trained up and working on this checkpoint. So that was approved on May 15th, and it took probably another month to go through our funding process at Nisga'a government to acquire the funds to be able to operate the program. And we were lucky enough to get through that process and begin on August 6th, at two locations, one on the lava beds and one on the Cranberry. Since then, we've been able to track the amount of visitors coming into the community, the amount of essential workers, as well as just general highway users and Nisga'a who are coming in and out of the valley. So the numbers we had and we're still compiling information, so this only goes until the 27th. So August 6th to August 27th, we had 3,656 vehicles come into the Nass during that time frame. About 58%, 2,151 were locals, so whether they're Nisga'a or non-Nisga'a, they're residents of the Nass Valley. They were going to Terrace or coming back and whatnot. We had about 879 of them be visitors, so tourists, recreational users, so that ATVs, motorcyclists, things like that, campers. So it was about 24% of the users. We had about 463 essential workers come through, so those that are conducting business with each of the 4 communities in Nisga'a government. That includes the contractors, the pavers, highway workers, whoever, and only had 4% refuse to answer questions. So 163 users that came in to the Valley, our RCMP, and some of the community members who just didn't feel comfortable answering questions. So those are reflected in that number, the 4%. So with that, we've been able to utilize this checkpoint when we had these suspected COVID-19 exposures with the events that occurred throughout near the end of August here. So once we had the information that came in on Saturday that we had a positive case come through the Valley from Vancouver, as it's been reported, I immediately called a meeting with our Emergency Preparedness Committee to discuss how we were going to react to this positive case. What was going to be the best course of action based on the Nisga'a Valley Health Authority's pandemic plan, as well as Nisga'a government's emergency response plan. So our goal, again, has always been to protect our elders and our vulnerable populations. So utilizing that information, as well as information from the pandemic plans, we immediately reverted back to phase 1 of our Nisga'a Nation Strategic Restart Plan. So with that comes the closing of or reduced hours of or denying public access to public buildings such as village government offices, gyms and whatnot, and developing and implementing the work from home policies so that business can continue. Implementing social distancing practices and self-isolation similar to what we had back in March through May. And a lot of this was geared towards those that attended the services that took place from August 21st to August 25th. So our goal was to get those attendees to begin strict travel restrictions in and out of Nisga'a lands, and having essential travel for those that did not attend the events. So we're trying to ensure that those that attended are informed at the checkpoint through social media and through announcements on the radio that they were to begin the 14-day isolation, and that they were also had the opportunity to begin a test, because the potential exposure began on August 17th, potentially. So that same day in the evening, we began through Nisga'a Valley Health Authority, the testing, the drive up, walk through laboratory testing for all of those attendees who took part in any of those events. And through those events, we had sign-in sheets for all attendees, organized by Gilakdamik's village government. They did a great job in trying to manage the event, and I worked with them heavily on the planning and trying to ensure that even though the numbers were not favorable, that those that were in the hall were all isolated from each other. The villages came through at separate times through their presentations and also the mandatory mask. So through that sign-in sheet, the village government began contact tracing and contacting all of the people that left their name and phone number, and letting them know and informing them that we had a positive case, a suspected positive case exposure within the Nass during that event. So they began informing them of what was expected. So the self-isolation, as well as achieving a COVID test. So just to reiterate, or just to recap a little bit, the people that did not attend these events are still able to travel to Terrace to do their shopping, to get groceries and whatnot, supplies and whatever. And we're asking those that did attend that they conduct a 14-day isolation. Through the checkpoint, we began changing our scripts. Most of my staff that work there are basically running off of a script that allows them to convey the same information. So their first question to those that are leaving the valley should be, did you attend this event? If you did, you should be staying home and isolating for the 14 days from the point at which you were aware that we had a positive case here. So if you did go to Terrace, or we had some people go over that weekend to Terrace as the notice came out, so they were aware when they came back, type of thing. So that's the guidance that we provided from the Emergency Preparedness Committee to the Nisga'a guardians, the checkpoint staff. And for the most part, we have been getting compliance. I know there's been a lot of negative reactions because of the new type of news that was shared, and our staff are doing the best they can with the work that they have to do. I know it's not going to be easy for them to continue on the work that needs to be done to help continue protecting our people, but they are doing it nonetheless. We have it manned 24 hours a day, and will continue to do so as long as it's required. So just going back to the notice that came out, what we are trying to ensure is that if you haven't already, make plans to receive a COVID test by Nisga'a Valley Health Authority, and you can contact their office to schedule one. To do a mandatory isolation of 14 days, and self-monitor for all the symptoms that were outlined earlier. I'll only read a couple. They've been shared by the healthcare professionals. So the fevers above 37 degrees, the chills, the cough or worsening cough, and so on. Also keep in mind, and it's been reiterated, but I'll just say it again, that a negative COVID-19 laboratory test result does not confirm that the individual is still not able to develop the active illness or transmit the virus. So self-isolation should still be done to its conclusion of 14 days. Mandatory travel restrictions entering and exiting Nisga'a lands for those that attended the events. We are trying to not keep turning people away, but when the tourists do come, we are informing them that we have had a positive case within the Nass here, and we're making recommendations that they do not come into the Nass. We're still allowing them to drive the highway. It is a provincial access road. So we make that recommendation, and they proceed if they so choose. So if you haven't yet, prepare for the 14-day isolation. If you went on a trip recently, and it had attended the event, this begins when you return from obtaining necessary groceries and supplies. You can also expect to be questioned by our Nisga'a guardians when leaving Nisga'a lands, and will be provided with a self-isolation plan to fill out. So this plan is basically a guidance document to help you cover as much areas that you may not have thought of when it comes to what you should be thinking about in self-isolating for 14 days. It's a long period of time, and we want to ensure that everybody is prepared, that needs to, is prepared for the entire length without having to leave their home. So again, just for those that did not attend any of the arrangements from the 21st to the 25th, we are limiting travel to essential travel as we are in phase 1. So you are able to travel to get groceries, but please limit the amount of traveling until further notice. I know there's been a lot of free travel as laid out by the province and in the current phase that they're in. But given the state that we are in right now, we are requesting that you please limit your traveling. If you don't need to go anywhere for the time being, please just stay home and be safe, and limit contact with those that are self-isolating. If you are returning from a vacation, I know it's vacation season. If you are returning from a trip beyond the Northern Health region, so from Prince Rupert to Prince George and everything north of that, if you're outside of those areas, we are asking that when you return and go past our Nisga'a Guardians checkpoint, they'll provide you with the self-isolation document, and that you self-isolate upon returning to Nisga'a lands. Even if you've received a COVID test, you should still self-isolate for 14 days to remain symptom-free before resuming your regular activities. So as we continue to move through this phase 1, as long as what we're hoping is if we get compliance with everybody that attended these events, that we limit the spread, whether we have positive cases or not, that we can begin to go back to phase 2 as soon as we hear from our healthcare professionals in our emergency preparedness committee meetings that we have clearance to do so. And when we have that information, we'll likely move back to phase 2. And and we've had many meetings also with the school district. I know there's going to be questions regarding school. That's supposed to begin around the 14th. And we've had meetings with the superintendent on the flexibility of their returning to school. There's been many different venues that they've used or avenues, sorry, to reach out to the public and share their plan. And the flexibility of this plan will allow us to continue to go through this phase 1 and transition out when necessary, so that we can ensure the safety of our children to return safely to school. We do want to ensure that they are kept safe through elementary through secondary and through our WWNI as well. So just to follow up with other things involved with phase 1, we have communicated with BC Parks on the Nisga'a Memorial, the Nisga'a Lava Bed Memorial Park. So that has been reclosed. So all provincial parks within the Nisga'a lands and recreational facilities, attractions on Nisga'a lands are closed. That includes our hot springs, our museums, our boat launches, our villages, as well as, I think that was it. So those are closed for now, and the signs are going to be changed. There is LED signs that still indicate that the provincial parks are open with limited services, so those will be changed. It takes a bit of time to ensure that those are changed appropriately. And also, so I want to make sure I capture everything here. I think that's where we're at to date. So our next meeting is scheduled for tomorrow. We've been having weekly emergency preparedness committee meetings and emergency meetings when necessary. And just to recap, we have an emergency coordinator from each of the 4 village governments, as well as the CEOs when they are available. I know their CEOs have a very busy schedule, but they attend nonetheless. We also have the superintendent from the school district, various members from Nisga'a Valley Health Authority, as well as the RCMP. The sergeant has been, or the corporal have been involved with our meetings as often as they are available. So that's, and also our directors, a few of our directors who have had emergency management training in some capacity have also been asked to be a part of this committee as well. So we've had many staff. There's about 30 people total on this committee. So that's the body that has been working collectively to keep each of you safe. The decisions aren't made just by myself. It's made by committee with lots of input from all of the members that are on the committee. And we will be here until the pandemic is over. So I think that's all I have for you, Bobby.
Okay, great. Thank you for that very detailed and comprehensive update on all of the initiatives that the committee has been undertaking since COVID in early March. Earlier, while Anthony began talking, I showed a section on our page where all information COVID related is posted, just so folks are aware that updates as they come in from the committee or any source of medical professionals is posted there. The most recent is a joint public service announcement that Nisga'a Valley Health and Nisga'a government did in collaboration with Northern Health and First Nations Health Authority. So this is available on our website. So feel free to check this out. And it's really to alleviate those fears that have resulted since recent events have transpired, and just to clarify the information and sources of information that you could resort to if you want to get medical advice. And most importantly, a reminder that we need to be kind and compassionate, as our good friend Dr. Henry tells us daily. And we really need to practice our Nisga'a edict of respect for ourselves and respect for others. So that is an important message that we must carry throughout the duration of this pandemic, because we all need to be in it for the long haul together. So with that, we'll lead right into our questions. A lot of them are our excellent team of panelists have answered during their questions, during their presentations, sorry. So I'm just going to ask the first question that came in earlier this evening. So we need clear, concise direction on testing, when and where. At first, we were told to just show up within a certain time frame at a first come, first served basis. Then we were told that it is a drive-up service. Then told to book an appointment, and this individual is still awaiting to get tested. So perhaps Sadeed and Brandi or Dr. Penner can tackle this. Again, I know you addressed it in your respective presentations, but it's good to recite the information again.
I guess I'm voluntold as nobody else went off mute. So thank you for the question. So Nisga'a Valley Health Authority there is a time frame in which to do testing. And I'm sorry, I don't know exactly when it is. I know there's testing in the morning to make sure we get the tests out in time for Northern Health to process them. But if you do contact your clinic, the reason we are asking people to make appointments is because it is drive up and we have to have the nurse actually outside. The reason it's drive up now is because as COVID has progressed and our information has progressed, we're not able to do the testing within the facility because there's a potential transmission within the facility. So please just call your clinic, book the time, and I'm sorry that you haven't got your test. If you can follow up with the health center, and if you're not getting anywhere, maybe just connect with Janice Angus, who is the acting CEO for Nisga'a Valley Health Authority, and then she can help navigate you through the system.
And just for the people who might be at this town hall, but they're living outside Nisga'a Valley, for the Northern Health, the standard process is calling into Northern Health COVID-19 clinic, and they will then support kind of assessing you, and as well as arranging for the testing. Due to the kind of capacity issue at Northern Health Clinic, we'll focus on people with the kind of symptoms. So if you're living outside kind of Nass Valley and have symptoms, ensure that you call the Northern Health kind of clinic, or you talk with your family doctors, and they can assess you and arrange for the testing at the Northern Health facilities. Thank you.
Just to go off of Dr. Kim, so for us, as I mentioned, the mild symptoms, moderate and severe being shortness of breath, chest pain, difficulty breathing. So besides those three, if I would encourage the community to utilize the provincial system of calling 811, because they are staffed very well, much better than our clinics at the moment, especially in the off hours. So it just frees up the lines for other emergencies. So if you have mild cases, mild symptoms, you feel chills, you feel warm, a cough, and body aches and such, runny nose as well, to utilize 811, and you will probably receive a much sooner response, as well as it frees up the lines for our own community members, our families and relatives, to be able to access that phone line if they need. They could be falls or accidents and other urgent matters, especially during the off hours.
Okay, great. Thank you all for your answers to that important question. This next one is in relation to masks, and I think it's an important one that perhaps any one of you can clarify. So we hear so much controversy about wearing masks and so much confusion about whether or not they are beneficial for anyone to wear them. Please tell us about the necessity of wearing masks, and if the homemade ones are okay.
I can quickly start some kind of comments, and check for other panelists for kind of further comments on that. The main kind of advice that the public health provide about the masking is that ensure you do all the regular practice first before you think about the mask. Like, ensure you do the good hand hygiene, ensure you stay home if you're symptomatic, ensure as much as possible to keep that physical distancing of 2 meters. Ensure you do the safe gatherings, that you can hang out with that kind of smaller kind of social bubbles. Don't go into kind of larger gathering of more than 50 people, and so on. So ensure you do all those kind of good practice, good regular practice first, then think about the masking. But the challenge with the masking is that masking alone will not protect you from the COVID-19 kind of risk. You need to do those regular practice first to ensure that you are protected. After that, then you can consider masking. So that's a kind of key point. Then the matter of masking kind of actually matters less. Like, there's a challenge with the masking because the most risky part of masking is getting it on and getting it off. So you wear the mask, you might be at the high risk area or high risk interaction, and there's potential for kind of the particles, including virus, in your masking. So it's difficult to, it's risky to get it on right, keeping it on right, so your particles are not getting out of the kind of side of the mask and so on, and getting it off right, so you don't contaminate your hands and so on of the masking. So it's really important you do the regular practice first, then the masking can add kind of protection, but that you will be protected through this package of the protective measures. And just adding on the question about the homemade mask, in the community setting, again, when all that regular kind of normal practice are done, then the homemade masking, done right, putting it on right, keeping it on right, putting it up right, will provide that kind of protection. But then we prioritize the medical grade mask in the medical situation where it's a more high risk setting with the patient with the COVID-19 or kind of risk factor. Yep, that's kind of comments for me. Thank you.
And Dr. Kim, it's Brandi. So can we, do you mind clarifying the mask? My understanding is the mask is more to protect others from your droplets. So when we're asking at the health center that everybody wears a mask, it is somewhat for the client's protection, but more so it's for the protections of other to make sure that COVID's not being transmitted into the health center.
Thank you. Yeah, the masking, as you mentioned, it's a more effective protecting the others by preventing your particle from getting out. So that is part of the mask can kind of provide, but again, ensuring that you do other regular practice, which are the very important part of the protection, they can protect you. So it's important that if the health center recommending masking for everybody to ensure that your particle is not getting out, that is great. But at the same time, also continue on with the hand mask, hand washing, as much as possible do the physical distancing.
Okay, thank you all for that. So the next question is in relation to the incubation period. This question is worded in relation to the possible outbreak, but I would rephrase that as the potential, how do we word it, Brandi? Exposure, sorry. So would you mind tackling that? So the date from notification, is it?
Is that the self-isolation period, Bobby? Is that what the question is about, the self-isolation in the incubation period?
Yes.
What we are requesting and what went forward with the joint announcement on Saturday is that we were requesting people would self-isolate from the Saturday. And the reason we're just asking for the Saturday is because we're not sure exactly what the time frame is. So we were asking community members to self-isolate from that Saturday, which was August 29th, and then for 14 days after that.
Okay, great, thank you. The next question is, and again, Anthony, you touched on this, but it's good to really reiterate. Do people coming back home from summer break need to self-isolate? So people that have traveled past Prince George and out of province.
So for those that are going to, say, Vancouver Island, the Okanagan, those that are basically leaving the Northern Health region, we are asking them to self-isolate upon return. And we have had questions about those that are going down specifically for medical trips, and we're answering those sort of on a case-by-case basis. We have many people that are coming here from Vancouver area or Vancouver Island for work or training, that are like instructors. So we have protocols for them specifically as well, and communicate with them weeks prior to them coming up. So yeah, to answer the question, if you're coming home from the Okanagan, the, what is it called, the Caribou region, Fraser Health region, any of those, anything outside of the Northern Health region, we are asking you to self-isolate. Yeah.
Okay, thank you for that, Anthony. So the next question is in relation to information that has come out of the news. So in recent news, it has been reported that a few people have been infected more than once with COVID-19, infected by different strands of COVID-19, showing that the virus is capable of mutation. If an infected person has clinically recovered from COVID-19 once, should the person continue to wear a cloth mask while in public? Dr. Kim or Dr. Penner?
Yeah, I can start the question and ask other panelists to add. Like, one part is that the reinfection right now is a kind of academic kind of interest, that we are getting the cases that there was a potential for kind of reinfection kind of both is kind of being studied. As a general kind of a pattern, like when you get the COVID-19 infection, when you recover from the COVID-19 infection, that we are, as a generally, you get that at least short-term immunity from the COVID-19. Right now, we don't know how long that immunity lasts as a general rule, and the virus is evolving. It hasn't shown any sign of a shifting, like a significant genetic change that cancel out any kind of a previous immunity. It's continued to drifting, and so we are watching it, so how that the earlier kind of immunity lasts. But right now, the people who get COVID-19 recover get the short-term immunity. Separate from that, that it's really important for everybody, including those with a history of COVID-19 or potential for exposure of COVID-19 or with no previous exposure to COVID-19, that everybody keep the good practice. So if the wearing a mask in a certain setting or situation is good practice, please keep on wearing the mask. Hand washing, kind of watching out for symptoms and stay at home. The measures we take for COVID-19 apply for many other kind of infectious disease. So it protects you from the COVID-19, protects community from the COVID-19, as well as other infectious disease, which actually include flu. So it's important you keep on with a good practice.
Great, thanks for that. Dr. Penner, did you have more to add to that?
Just one way to think about it is like the common cold. So we're not sure yet, but we may see that it's something like that, where you can get a cold and then, you know, a few months later, your kids come home with a cold and you get the cold again. And then a month later, your child comes home from school with a cold, you have a cold again. So it may be something like that. And some of the viruses that cause the common cold are also coronaviruses. So we just don't have enough information yet because this is new.
Okay, the next question, for clarification, people that attended the services need to self-isolate. Do the people that have been in contact with those that attended need to self-isolate as well?
I can say that generally the contact of the contacts of people without the symptoms do not need to kind of self-isolate, but again, keep on with the regular practice. Just continue on with that kind of self-monitoring and ensure that because regardless, like with this new norm, there is a baseline COVID-19 risk for everybody that the individual and communities are kind of practicing against to protect each other. So just ensure you continue on the good practice, but regular practice at this point for the contact that does not need to include self-isolation, and checking with the Nisga'a Valley team for any further confirmation or update or correction.
Okay, great. Thank you for that. I think at this point that we'll wrap up our questions, and we got a lot of excellent ones. And as I mentioned at the beginning, time may not permit, and we're probably at about just approaching about an hour and a half of this excellent informative discussion. And as I promised, I have one of my colleagues, Destiny Clayton, who is also co-hosting in the background. She's documented all of the incoming questions, and as I stated, we will form this into a frequently asked questions document that we will have each of our panelists review and add their information and knowledge to, so that we can publish it on our website once that's complete. So at this point, I would like to welcome each of our panelists to provide closing comments before we wrap up for the evening. Starting with you, Brandi.
Thank you. I do appreciate the support of all those on the line, both the panel members as well as the participants. I do just want to remind people during this time to really look after ourselves, to be kind to ourselves, be kind to others. We are living in unprecedented times, and it's pretty much guaranteed that we're going to make mistakes and there's going to be gaps. And I just ask that everybody's kind and patient with each other and just understanding in these times. And I just pray for the health and wellness of the nation and all the members. Thank you.
Great, thank you, Brandi. Dr. Kim.
Thank you so much for this opportunity to kind of talk to and talk with the community of Nisga'a Valley. And that I appreciate this kind of rigorous work and response with the Nisga'a Valley community and community members, which will protect the community as well as the kind of neighboring communities. So thank you for this this work as well as the continued work together.
Thank you for joining us on relatively short notice, Dr. Kim. Dr. Penner.
Yeah, thanks for the organization of this meeting, and for everyone who's attended, and the great questions. And there are a lot of questions that we haven't been able to answer yet because of time, but I'm sure all of the panelists will contribute to answering those. I do just want to clarify that the people who did self-report when they returned to Vancouver, so Vancouver Coastal has confirmed 3 of those. So this isn't just acting on rumors. Vancouver Coastal has confirmed that 3 of the people who did test positive and are confirmed positive now were in the valley during potentially infectious period. And just also to reiterate something that Anthony mentioned, all of these measures are really for the protection of the most vulnerable people in the community, and we know this is difficult for everyone. Self-isolation isn't good for our mental health and our well-being and our livelihoods and such. But hopefully in the long term, these measures are justified to protect the nation.
Excellent. Thank you for clarifying that the confirmed cases, Dr. Penner. That's important information. Sadeed?
Thank you. Just as a closing comment, I want to add that although I encourage the community to use information that's on other health authorities' sites, which nonetheless, is on the same theme of COVID, using 811 for information as well as assessments if they need. But that because our context here, where we are, is unique to our own lands here, information might be accurate to Vancouver or to another province, but if we could, be mindful of that, that information speaks to that location, and that for our location to seek information on our local sites, that would be best, and then we can all move forward in unison.
Great, thank you very much, Sadeed.
Thank you.
Anthony?
Thank you, Bobby, and thank you to all the other panelists. It's been some great discussion today. I hope that we answered most of your questions. I know there's still about 88 other questions that have been posed, and we will endeavor to answer them. As a closing comments, I'd like to reiterate that our checkpoint, our Nisga'a guardians, are our people. They're our cousins and our nieces and nephews and uncles and aunties. They live here too, and there's been some minor cases where people were not happy with the checkpoint being there, but it's there to help protect us, to help share information to highway users. So I just want to ensure that they're safe to be able to carry out the duties of their job. As we sit in phase one, as long as we are diligent about how everybody goes through their 14-day isolation, which basically means you should be at home, refraining from contact, leaving home as much as possible. And if you leave at any point, essentially going through the definition, it should restart again. Social distancing, there's lots of different definitions out there. The idea of a social bubble has been used a lot and misused. So just want to clarify with that a social bubble is essentially members of your family or members of the area where you work, people that you work with and see on a regular basis. Those people you interact with are a part of your social bubble, your immediate family and things like that. So yeah, as we continue to move through phase one, we hope that we not have to stay in phase one for too much longer. We're hoping that this early and definitive action that we've taken has been able to limit the spread if we do end up with a case here. And then we can revert back to phase two, hopefully within the following of the 14-day isolation. Once we start getting a large number of negative reports going up off the recommendations of our health authorities, Nisga'a Valley Health, Northern Health, and First Nations Health, using their advice, we can revert back to phase two and eventually phase three, which involves our schools, getting the schools opened up and getting our children back to school. So that being said, I wish you all a safe and quiet evening, and I hope you found this informative. we did want to ensure that we had explanations for our notice that we sent out on Saturday, and that it was clear what our expectations were for our people, and hope that a lot of the misinformation that can be found on social media has been answered, and that you follow the formal sites, the BC CDC sites and health authority sites for the actual information, and not trust what's on social media so much. A lot of it can be altered. So yeah, have a good evening, and thank you, Bobby, for moderating. I appreciate it.
Excellent. Thank you.
Thanks, Bobby.
And thank you to each of you, the excellent panelists that provided very detailed and comprehensive information that I'm sure answered a lot of those uncertain questions that our citizens have had since the beginning of COVID. I would like to thank the attendees. I think we peaked at 130 this evening, competing with the Canucks. I just did a quick Google and I see they're 1-1 in the third. So with that, and just for the information of our attendees, this session was recorded, and we will have our videographer, Paul Mercer, do some editing so that it's ready for publication on our website. And we've also received a question in relation to the timing of when we will publish our FAQ. I believe my colleague has captured each of the questions into a document. We'll circulate to our panelists immediately, and we'll get that finalized at the earliest, and then we'll publish on our website. So with that, I would like to call on the kindness of a member of our executive that was kind enough to join us this evening, Bilan Nair, Madam Secretary Treasurer Corinne McKay, if she would provide closing comments and a word of prayer.
Thank you, Bobby, and thank you to the team that came together this evening to help inform us and to provide the education that some of us may need to understand the challenges that we're going through. With that, I'd like to ask you all to bow your heads this evening. Dear Lord, we come to you with gratefulness for those that are working to help support us during this uncertain time, and we're grateful for those that are still doing well, that are following the protocols, and we pray that you would help to motivate us to continue to do what is necessary to keep all of us safe. We pray that you would watch over us and provide us with your armor of protection, us as people and as a nation, and to all of our healthcare providers, and to the team that's working on behalf of our people. We're grateful. We pray that you would watch over them all. This we ask in your name. Amen. Good night.
Have a good night, everyone. Be safe. Take care. Be kind.